contraction.
Okay guys, today we're going to talk about scapular stabilization. And if I say stabilization, hopefully you think about co-contraction. So it's really about getting the muscles around the scapula to contract and work together. Dr. J likes to talk about it as a dance, and I like that analogy. When one muscle contracts, another has to relax a little bit, or vice versa. So when we're looking at the scapula, these are really postural muscles. They are not big, bulky strength muscles. You're not going to give somebody 50 pounds and ask them to do rows or scapular retractions with them. We're really looking at endurance of these muscles. They're mostly made up of type 1 fibers, our slow twitch, our endurance fibers, and that's really how we need them to work. Scapular stabilization is really mostly about motor control, getting the right muscle to work at the right time to do what you want the scapula to do. Okay, I'm just going down my list here. The other thing that's a little bit different about scapular stabilization is that we're always going to start with closed kinetic chain activities. Okay, once we get into exercises, closed chain are actually easier than open chain. So we'll talk about the progression a little bit. Okay, the first thing you need to do is get your patient aware. So we need to do neuromuscular reeducation usually with these patients. Pretty much anybody who had any kind of shoulder issue is going to need some scapular stabilization. Because what happens if we hurt our shoulder? How do we all position ourselves? Ow, my shoulder hurts. Okay, and you isolate it and you hold it and you immobilize it. And what you do is you stretch out all of these muscles and they shut down. So we need to get the patient working again where they can move their scapula and they're aware. So patient, if you will lay on your side towards me, and hopefully you guys can see. One thing we will often start with, just relax your arm for me, is just teaching the patient how to move the scapula. And my cameraman, if you need to get a little bit closer, okay? I will usually hold my patient's arm just so I can move, and her scapula is right here, and I am gonna passively move it. And patient, if you'll just relax for me, and I'm just gonna move her scapula superiorly and inferiorly, and I can move it forward and I can move it backward. Now, when I'm doing that, you don't wanna grab her shoulder, you don't wanna grab the glenohumeral joint, but I can grab the spine of the scapula, her acromion process, because that is all scapula. The arm is gonna kind of come along for the ride. But just make sure you're moving her scapula. I don't want to jerk her arm all around. Remember, she probably has a shoulder injury, and that's why we're working on this area. Okay, so patient, I'm just going to move your arm up and down for you at first. Okay, and let me do this. Okay, and we're just going to go up and down. So I could start passively, and then when she got the hang of it, patient, would you help me with this motion? Okay, now so you're activating the muscles a little bit. Okay, once you got the hang of that, I could say, can you do that on your own? Go up and down just the way we did. Good, then I could give resistance. Okay, so we went from passive to active assisted to active to resisted. So to resist this, I'm gonna get right on the spine of her scapula and say, can you push up for me? Up, 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 good. And then to go down, a really good space to be.
So weird.
Sorry, is here. I'll do. Okay, I'll try to be back here.
Okay.
Tell you what. If you have a ticklish patient, as often we do, this can help. Just put the towel there, and you guys will just have to imagine what I'm doing is I'm getting up under the lateral angle, and I'm using that as my resistance. So patient, can you push down into my hand? Nice. And now can you push up? Good, and push down. Good, and push up. Good, and push down. Good. Okay, we can do the same thing with forward and backward. Okay, so for forward and backward, I'm gonna get right at the medial angle. I'm sorry, the medial border of her scapula. Can you push backward into my hand? Good, and then I can come to the front, right where the coracoid process is, so right under her clavicle, and can you push forward for me? Good, and now push backward. Good, and push forward. And push backward. And push forward. Good, you can see I'm not on her glenohumeral joint. Okay, I'm getting on the scapula. Okay, so once she has done the neuromuscular reeducation, and how many reps and sets would you do of neuromuscular reeducation? 1 set of 10, that's a perfect answer. You guys are brilliant. Okay, once she can fire all the muscles, now it's time to actually start using them and challenging them. So again, I could have done the MRE on the table, but let's get her a little bit more active. Okay, so we're gonna start with closed kinetic chain. Patient, if you can stand up for me. Okay, and we are going to, there are no walls. We will use this wall. Cody Bryant, yes, okay. So patient, what I want you to do is you're gonna put your hands on the wall like this, and you are going to—
Am I gonna need to take my socks off for this one?
Only if you feel like you're sliding.
Okay, what am I doing?
Okay, so you're gonna weight bear just a little bit, and what I want you to do is do your scapulas up towards your ears and down towards your waist, and then I want you to push them forward as far as you can, and then I want you with control to bring your scapula together, keep your elbows straight. Good. Come back to the middle. Okay, go up, go all the way down, and go all the way forward, and go all the way back. Good, okay, so that's a scapular clock. You can tell them to go up towards 12 o'clock, 6 o'clock, forward is kind of like going up towards 3, and then back is kind of towards 9, okay? A progression of that would be more weight bearing. So from a wall, we could go to plantigrade. Okay, so your patient is kind of in a plank position on a table. Now this is more weight bearing, it requires more control. Okay, and the table is sliding. So I'm gonna hold the table. Okay, and I want you to do exactly the same thing. So shoulders up towards your ears and then down towards your waist. Really think about your shoulder blade. Now push your shoulder blades forward and then bring them back together with control. Okay, now from there we can go to more weight bearing, which would be in a quadruped position on your hands and knees. Okay, and you can do that up here. And then from there you start working into the plank. So plank on elbows or plank on knees before you went to a full extended arm plank. Okay, so those are scapular clocks. There's another type of clock you can do. And this clock is all about stability. You're not wanting your stable arm to move, but I'm gonna move my body. You're asking me to reach in all different directions. So again, 12 o'clock, 6 o'clock, 3 o'clock, 9 o'clock, and everything in between. And the one that's doing all the work is the arm that you're staying on. Again, from there, you can go to plantigrade and then onto the floor, 4-point, or into plank positions, okay? A term you might see is called threading the needle. So if my patient will get into this patient position, and what I want you to do is reach over here, okay? That's called threading the needle. That's adding a rotational component, and it's hard. It's not so bad on the wall, but try it in a plank position. He wants, oh, she likes the challenge.
Can you hold the table?
I will hold the table.
Okay, so it's like that?
As far out as you can go.
It's not that bad.
Okay, sounds like a challenge on the floor. Full plank. She has strong arms. Nice and slow.
Like that?
Slow.
Come on!
Do other
Slow,
side.
with control. Yeah, she's in color guard. She's got really strong arms. Oh, she's stable. Okay. Another thing you might have seen in the clinic is ball circles. This is about endurance. So again, once they can hold their scapula in a stable position, you're asking them, can you see, cameraman?
I can see a little bit, but I'll get it closer if you request.
Okay. You're asking the patient to hold their scapula in a good position. It's not winging. And you're asking them to do something like this. It's all about endurance, okay? I could go up and down. I could have my patient facing this direction and doing it, or up and down, or back and forth, or whatever motion you want, but it's just endurance, okay? Let's see what else I had. Marches, okay? Something else that's really about endurance is just having your patient do a march without winging their scapula, and I'll show you what winging looks like in just a second. And again, the progression of plantigrade, which is on the table, down to quadruped. You can even do treadmill. You can have the patient, sorry, kneel, it's okay. And you can actually have them pull it back. Or you can have it running and they have to walk and keep up with the treadmill as it goes. That one's kind of fun. Okay, let me change my patients if I can. And now you're the patient. Would you take off your jacket for me? Okay. Have you had a short sleeve on?
This.
Okay, well, we'll see what we can see.
It's pretty light.
Okay, so Joe,
I can run.
it's okay. So can you go back into that kind of push-up position that Mia was in?
Straight back.
And just let your shoulder blades kind of go. Okay, so his shoulder blades actually almost overlap. Okay,
He can make them.
he can, yeah, I don't want you to, it freaks me out. I'll tell you what, let's go to the wall. Because Joey is hyper flexible and his shoulders can wing. So just kind of let your chest go. Yeah, there we go. So this is winging scapula, okay? I am underneath his scapula. There's
a pencil in there.
he could hold anything, okay? So this is what winging scapula would look like, where they're just kind of poking out. And that's what we don't want, and we would teach him not to do that. Ever. Don't do that.
Party trick.
It's a great party trick. Although my favorite is this. Yeah, I love that party trick. My boy.
Many others.
Yeah, that's not normal, Joe. Okay. Let me see. Okay, so we talked about some of the progressions which are positional. Wall to plantigrade to down on the floor, 4-point to a plank position. Okay, some other progressions would be from a single plane. So for example, just having somebody, this table keeps moving, march like that, thank you, to going into a multiple plane. Okay, and then going into functional movement, okay, because any exercise is easier if you're concentrating on it. But what if after we have done P&F diagonals, or we have done threading the needle and opening up, now we give them something that has to do with their job or a household task, like putting things away. And then what happens is your mind is on the task and you're not really thinking about your form anymore. And that's where we really see what's stuck. Okay, do they really get it? Have the muscles been retrained? Is it now automatic? And sometimes that's where you see you got to back up the truck, go back, get a little bit more endurance, get a little bit more awareness, and then again, go back to functional tasks, okay? So your job is I want you to try some of these, okay? I am gonna be loading a video and some questions. The questions aren't gonna be due as an assignment. It's just that I want you to think about the questions so we could talk about them on Zoom. So that is your assignment, to try some of these, to think about progressions and regressions, to think about the muscles that are involved in scapular stability, okay? And here's a question. Is the latissimus, dorsi, of course, the latissimus dorsi, a scapular stabilizer? So I want you to think about that. And we're gonna be talking on Monday in our Zoom meeting about all of this and about your homework you did about the compensations and how you tried to fix your patient who was cheating doing their exercises. Okay, thanks for watching.